So next we are looking at another classification, and this is, you are trying to look at the various investigations that can be done for gynecological conditions, right? So looking at these investigations, you're actually trying to look at the classification. So earlier when we were looking at the overview, we said these investigations are divided into what? The general ones, and also the what? The general ones are non-specific. Then we also have the specific ones. Alright, so let's look at the general investigations that might actually be needed to be done in gynecological issues and also obstetric issues. So to conduct a general non-specific investigation of gynecological issue, a clinician typically follows a systemic approach. Do you understand? So first, you are trying to take history of the patient. You are trying to know their menstrual history, trying to know their obstetric history, trying to know their sexual history, trying to pick up all the symptoms. You understand? Trying to pick up the medical history, trying to pick up the surgical history. Alright, of course this will help you to now start suspecting what is actually wrong with the patient. Then for the physical and pelvic history, usually performed with sensitivity and privacy. Okay, that's all those examination. So general examination, you take up the vitals, take up the signs of anemia, then you also dictate if there's any abnormalities with hormones. Abdominal examination, you are trying to see if there's masses or tenderness. Alright, pelvic examination, you are trying to check out the vulva, the vagina and all, to actually see if there's any abnormalities with that. Okay, you can see that this one is it should be hysteroscopy, right? Okay, or colposcopy. So laboratory investigations, blood tests, you are doing complete blood count. Alright, Erythrocyte Sedimentation Rate, C-Reactive Proteins. Those ones, you are just trying to establish that if there's an inflammation. Hormonal assays for follicle stimulating hormone, luteinizing hormone, estrogens, progesterones, prolactin. All these ones you are just trying to see if there's any abnormalities. Then urinalysis, the routine one and microscopy, then also the culture. Now you are doing a culture because you want to dictate if there's presence of any microorganisms. Then pregnancy tests like the human coronary gonadotropin dictation test. So microbial and cytological tests, all those vaginal swabs, cervical swabs, pap smears, HPV testings. Then imaging studies, you do ultrasound, MRIs, hysterosalpingography. Alright, all of this will help you, to know if there's anything wrong. Okay, so special procedures called colposcopy, just like I was showing you guys here. Alright, then endometrial biopsies, cholecystectomies, laparoscopies, hysteroscopies. All of this will help you visualize the inside. Okay, so that's it for this.